have you ever heard about prescription digital therapeutics? It's a new digital method hoping to prevent, manage, or treat medical disorders and diseases.
All right, it sounds a little complicated. There's also a new bill that goes along with this. It's in Congress, hoping to bring this to the masses. So, here to explain what all of this means, we have the head of digital health at the American Telemedicine Association, Andy Molnar. Thank you for being here.
Thank you so much for having me.
You got to break this down. We've been talking about it all day. What is it for people who don't understand? What, a PDT?
Well, a PDT stands for Prescription Digital Therapeutic.
Okay.
Okay.
All right.
I'm going to talk about digital therapeutics. We can add the prescription piece in later if that's okay.
Okay. All right.
Okay. So let's talk about insomnia.
Yeah.
Okay.
Yeah.
And hopefully this will make sense. So 10% of Americans suffer from insomnia. That's about 36 million people.
Wow.
Okay.
Wow.
The first line recommended treatment for insomnia is therapy, cognitive behavioral therapy. Do you know how many doctors there are that deliver cognitive behavioral therapy for patients with insomnia?
Not that many.
You're right.
I don't know.
Okay.
It's
Only
got to be a doctor.
A little bit more than 750.
Wow.
For 30 million people.
Wow.
Okay, so we're all used to mobile health, right? You can actually listen to Matthew McConaughey read you bedtime stories, right? And that's great. And if you have mild insomnia, that's fantastic. But if you're truly suffering from insomnia, you go to your doctor, they prescribe you medicine, right? But if you need true therapy to find out the root cause of that, then you have to find one of those 750 doctors. So
Hard to reach them.
how do we do that? We actually put that tool into an app on your phone, and we run it through clinical trials the same way that you would look at a drug or a medical device, and we prove that outcome actually improves your insomnia. Now, there are 300,000 mobile health apps on the App Store, and you don't know if they work.
Right. We were talking about that. There's
That's
so
a
many
lot,
choices.
too. How would you even know which one? And,
Right,
Yeah.
and there's products out there to help treat diabetes. There's a non-invasive treatment for panic disorder. Patients with panic disorder oftentimes can't leave their house. They
Right.
can't even go grocery shopping. Using this therapy for 28 days, 70% of patients are panic attack free for an entire year.
Wow.
That is life-changing.
Yeah.
And patients don't get access to this because of the way that our Medicare program is built.
That might be more effective than even a medication for panic disorder. That, you said 70%.
70%.
That's
yeah.
impressive.
I don't know another one
Okay.
that works that well.
Yeah, so it
Wow.
sounds like this is helping people who need help with access.
Oh, yes.
Okay.
Yes.
That's
All
the
right.
problem.
Right. So the Medicare program
Yeah.
was started in the 1960s. So they thought that all treatment was going to be within the four walls of the doctor's office. They never thought we were going to have a supercomputer in our pockets
Yeah,
in 2025.
Right.
It wasn't even until the early 2000s that there was a prescription benefit for the elderly.
Yeah.
And so now innovation has so wildly surpassed the way that these programs were built. We have to bring our 20th century healthcare system into the 21st century.
That makes
It's
a lot of
time.
sense. That makes a lot of sense. Though you described it well, now I get it. Now there's a bill.
Yeah.
Yes.
Tell us about this bill.
So the bill just puts the infrastructure in place. It's not forcing Medicare to pay for the products. It's not telling patients that they need to take the products. It's just saying right now, there's no way, not no way, but it's very hard for patients, especially in like rural America, to get access to the therapist or to go into a hospital. There's all these virtual treatments, and this bill puts that infrastructure in place so that these patients can have access to these therapies.
So the doctor would kind of prescribe this app or this digital therapy.
So the prescription products the doctor prescribes just like you would have a drug. But we're not used to that, right?
Yeah.
Right.
We're used to using mobile health, and we're used to pills.
Yeah.
So if
Right.
if I were to prescribe you a virtual reality headset to help you manage your pain,
What's this guy talking about?
right?
Right.
Yeah.
But that is so
We just
clinically
need to
validated
wrap our
and
heads around
effective.
it.
It's
Yeah.
amazing.
Okay, I know this is the beginning of the conversation, and you're in town all week. You're going down to the Hill. If you would like to learn more, you still have questions too, you can go to ataaction.org. There's so much more there that you can explore. Thank you for being here.
Thank you for having
so
me.
much.
Yeah.